Shrink baby, turn it out.
As the saying goes, the mind is everything. What you think, you become. My name is A of the Good Life, and I'll be your host on the Soundman podcast, where we explore diverse tapestry of life's most vital traits. Listen to the Soundman podcast on Spotify, Apple Podcast, YouTube, or wherever you get your podcasts from. Welcome, guys. Welcome to episode 3 of the Soundman podcast, and I remain your favorite host, A of the Good Life. Thank you all so much for, following up on our previous episodes. The reviews and the stories so far are quite encouraging. And to everyone who is going through one issue or the other with their family, we're sending you love. Also, there's something I really want us to know from our last episode. Most times, our parents tend to, transfer most of the aggression they have based on the things they've experienced while growing up. Yes, in as much as we do not want to blame them 100%, we should also be very careful not to allow these things get us personally. What I mean is that, like I said before, when you experience things like this, you should try as much as possible not to let it get the best of you, thereby transferring it to our unborn children. Tomorrow you become a father, tomorrow you become a mother, and it will be very sad seeing that you transfer this trauma you are having right now, or you may be having to your children. Please, let us do it to, find the best help we can. Thank you so much. Bringing us to today's topic, I'm really excited about today's topic. This one is for everybody, both male and female. And in a bid to celebrate the International Women's Day that took place this month, we decided to come up with this special episode for our women. Our topic today is a common but yet misunderstood condition that affects women, which is called PCOS. I believe most of you are familiar with the name PCOS, which means polycystic ovarian. I'm not really sure about it, but then again, no problem. Today with me in the studio is our very own doctor, a friend, a sister. She's everything. Today in the studio I have with me no other person than Dr. Faith. I'm happy you are here with me.
Thank you.
Thank you for taking out time for your busy schedule to, come to this episode with us. I'm grateful.
Thank you.
How are you doing? How's everything?
I'm fine.
You look good.
Really?
The medicine life is showing in your body like this. Well, to get things started, let's not waste time. What is PCOS?
Okay, thank you very much for having me. I am very honored to be here.
Thank you. I'm more honored than you.
Really? Okay, PCOS, it's polycystic ovarian syndrome. And this is a syndrome of ovarian dysfunction. It has signs and symptoms of excessive androgens in the body, oligo or anovulation,
Okay.
and polycystic ovarian morphology. So oligo or anovulation literally means that there's reduced ovulation. So these women are not ovulating
At all.
Reduced. So there could be reduced ovulation or not ovulating at all.
Okay,
Yes.
okay, makes sense.
Yeah.
Oh. Okay, moving forward, what are the common symptoms women might experience?
Okay. Common symptoms they experience are menstrual irregularities. So these menstrual irregularities, they range from having infrequent periods to prolonged or heavy periods.
So as they have period for a very long time.
Yes. Or they don't have at all for like a month, 2 months, then have again. Or they have for like 3 days, 5 days.
Wow. So people go with a whole month of not seeing their period.
Yeah.
No, they're not pregnant.
They're not pregnant.
Some 2 months, so that's in their period.
2 months, 3 months.
Wow.
Yeah.
Okay, go on.
Yeah, so that's one of the symptoms. So they could also have signs. I already mentioned they have excessive androgens. So
Okay.
signs of excessive androgens, like hair on their chin.
Oh, they start having like masculine
chest.
features.
Yes, exactly. Voice deepening, receding hairline. They have acne.
Oh.
Yeah, a lot of acne too. So that's also part of the things they can present with in the hospital. They can also present with infertility. I already mentioned they have anovulation. That's they're not ovulating.
Yeah, so
reduced ovulation.
They cannot conceive because of
Yes.
Okay.
Exactly. So that's usually the first symptom they even present with to the hospital. They are trying to conceive. Then obesity too. Some of these patients, there's insulin resistance, which makes it difficult to lose weight.
Oh.
Yeah.
Okay, so the PCOS that makes the insulin resistant, like what you're saying, let me not misquote you. So makes them quite unable to reduce weight.
No, it's possible. It just makes it a little bit difficult. Just a bit different. It's not okay, even if they usually, or like if me now, I'm able to lose weight at this particular extent, they may need an extra push.
Okay, I get it now. It's quite alarming how many women might have PCOS without even, knowing. You understand?
Yeah.
So, what are some of the common misconceptions about PCOS?
Okay.
Because many people think it's like this one and it's not. Maybe people just have different view of this whole PCOS thing.
Yeah, true. Okay, one of them is some people say it affects only women that are overweight, and it's not true. Yes, obese women, people that have obesity, they are at more risk of developing PCOS.
When you say obese, I'll be obese to say
obese.
When you say obese, then it means like fat.
Well, yes, but it's call it obese.
Okay. Overweight. Okay, let's use overweight. Okay, go on.
Okay, so obese women are more likely. They are more likely to have PCOS. It does not necessarily mean it only affects them.
Okay, so
an obese woman could also not she could also not have PCOS. Yes.
Okay. So if I'm getting that straight, the misconception is that only obese, overweight women, have PCOS, and that's not true.
Yes.
Okay, makes sense.
Yes. Then also, some people say they can't get pregnant because they have PCOS. That is also not true. You can get pregnant. Yes, it affects your ovulation, but medicine is progressing and improving.
That's true.
So get to see your healthcare provider. He'll pick something that will work for you. So they'll induce ovulation for you, and you can then conceive and get pregnant. Then that's problem.
So that fear of I have PCOS, I cannot give birth, is not a thing.
It shouldn't be, but it is. But it shouldn't be.
And me personally, this PCOS of a thing, I did not know about it earlier. I think back then in school, I was not aware about PCOS. But now I'm getting to see it online, see a couple of people,
people are now talking about
exactly,
it.
Exactly, the awareness is coming. That's why I wanted us to talk about this extensively based on the month for women and mothers generally.
Yes.
So show that we really care about them here at Soundmind Podcast. Okay, let's talk about the diagnosis and treatment options.
Okay.
How is PCOS diagnosed and what are some, strategies to manage this condition?
Okay. So for the diagnosis, we use a criteria. It's called Rotterdam's criteria.
Rotterdam's criteria?
Yeah, Rotterdam.
Okay.
It's called Rotterdam's criteria. So making a diagnosis of PCOS, it involves having 2 out of 3 criterions, because this Rotterdam's criteria has 3 criterions. Okay. So having 2 of it can help you make a diagnosis of
PCOS.
Yes, and you are ruling out other possible causes of the symptoms the patient is presenting with. So these 3 things that the criteria includes oligo or amenorrhea. Earlier I already said oligo or anovulation. So oligo or amenorrhea, it's the clinical manifestation, what you see. That's the irregular menstruation that you see. So it's either reduced or no menstruation.
Yes,
These are do you understand? So this is the clinical manifestation of that anovulation I mentioned before. So you could also have clinical or biochemical signs of androgen excess, which I already said before also. So the clinical signs are those hair on the chin, hair on the chest.
Acne.
Yes, acne. Then for the biochemical signs, you can test your blood and see that the androgen levels are increased.
Okay, so if I'm getting you correctly, when you test your blood, you can tell that the male hormone in your system is in a very high
hormone
level.
Profile.
Okay, wow.
Yes.
Okay, go on.
Then the last one is doing an ultrasound scan, then seeing the polycystic ovarian morphology in the ultrasound scan. So having 2 out of these 3,
can be diagnosed with PCOS.
Yes, after eliminating other possible causes.
Okay.
Do you understand?
What are these other possible causes?
Like uterine fibroid now. A woman can have heavy periods from uterine fibroid, and a woman can also have heavy period from PCOS. So you should try to rule out all those other causes first before you.
Okay. Okay.
Then the management options, you said treatment options, right?
Yeah, how can one manage, the PCOS?
Yes. So the treatment options, they are based on each symptoms, basically.
Okay.
So for the menstrual irregularities, you use COCPs, combined oral contraceptive pills. These, they help to regulate the menstrual cycle.
Oh.
Yes. Then for the hair on the chin and chest, you can shave, you can do laser, you can do electrolysis to help for cosmetic. Nobody wants hair on their face.
Yeah.
Do you get? So that can be done. Then use of oral contraceptive pills that have anti-androgenic effect also can also help with this androgen excess.
Anti-androgenic effect is this are they oral? The oral
Yes,
pills?
the oral pills.
Okay, they help repel the action of the androgen.
Like that, something like that.
Okay.
Yes.
I'm learning too. I'm learning too.
Then something that is very important, the lifestyle modifications. So exercise is important. As much as I already said, it does not affect only obese women, but like losing weight is essential it's essential in their management, because weight loss has been shown to show reduction in some of the symptoms that PCOS comes with. So most times when you go to the hospital, we tell you to lose weight. People are angry, but we know why we are saying it, because it helps improve the quality of life generally.
Generally, that's the word.
Yes, generally. So it's very important. Then stress management also is important.
Okay, so we are saying we should reduce the stress.
Yes, there are so many ways to reduce stress. Yes, the country is stressful, but
of course.
Reduce stress, relax, calm down.
All right.
Yeah.
All right, that's so much helpful information you've been dishing out. But before we wrap it up, what advice do you have for women that maybe having, they suspect they have PCOS?
Okay.
One, and what about those that have just been diagnosed with PCOS?
Okay.
You have two different group of people.
Okay. So for those that feel they have PCOS, I believe they should present to the nearest or their healthcare provider, nearest hospital, their healthcare provider, and say their symptoms, whatever symptoms they have. They will get history from them. They will do an examination. They'll run some tests for them. Then they can be properly evaluated and properly diagnosed, instead of just staying at home and worrying, or staying at home and Googling, because Google tells you so many things and does not tell you anything at the same time.
Google is your friend and your enemy at the same time.
Do you understand? So go and see a doctor and get that checked out. Then for those
Stop assuming.
Then for those that are just diagnosed, yes, it's not easy. Most women don't like the idea that they have to take an extra effort to give birth, or the fact that they wake up with hair on their face.
Yeah.
But it's not a death sentence. It's not the end of the world. It can be managed with proper treatments, proper follow-up. Can be properly managed. You just have to calm down. If you're too worried, educate yourself more. Try to understand your condition more. Read about it. Talk to your healthcare provider about it. Connect with other people with PCOS.
Oh, okay. There's a community for people that have PCOS. I think that will help also big time. Yeah, that's true.
Yes. So connect with others that have PCOS. They understand you. You don't even have to be scared. Speak openly with your healthcare provider about what your concerns are. Yes, sometimes it may seem like we don't understand you, we are not speaking your language, but we understand, we get it. So speak openly about your concerns. Whatever it is, there's always a solution.
So that's true.
Yeah.
That's
true.
I
think then have a positive mindset generally about it. It helps. It just improves your life generally. So I think that's my advice.
I read something in the course of preparing for this episode. They said it also affects women, like women that have PCOS. Yeah, it affects them emotionally, sometimes mentally. They have mood swings and all that. What can you say about that?
I feel it's the psychological impact, because some become very anxious. Like, it's associated with a lot of anxiety. Some women are worried. Oh, will I be able to give birth? Will I not be able to give birth? This weight I'm gaining, will I be able to lose it? Okay, my doctor said I should do this. It's not something that seems I can do. Do you understand? Yeah. So it's a lot. It can be a lot for them. So they're crying, some are depressed. So as I mentioned before, try to get support around you. It's not so easy, but have support. If it's even necessary, seek professional help. Therapy can just be the solution you need. Talk to somebody. And that's...
Understand the problem. Don't assume.
Because
sometimes this misconception might get to you personally.
Yes,
your friend
and
will
you're
understand.
feeling so bad, and you're talking to someone, they feel like you're not even making sense. It's very, very painful.
People don't understand.
Yes.
And that's how easy meets to tell you, I think I get it. I get it. Well. Thank you so much.
Thank you
you so much for, taking time to share light on this particular topic. Is a bit to empower women to understand their health personally.
Okay.
You understand?
Yeah.
And to all our listeners, both male and female, knowledge is power. And as a man listening to this episode, the knowledge is not a waste. You have sisters. You understand? You will give birth to children tomorrow. Mm-hmm. You have wife. You have girlfriend. You have sugar baby. You have anything. Hey. So take time to listen over and over again. You can't say because you're a man, you will not pay attention to this episode, because tomorrow you might be there to educate somebody around you. And to our ladies, please take care of your health. If you suspect you may have PCOS or any concerns about your reproductive health, don't hesitate to reach out to your nearest healthcare provider, like you called it. See a doctor, go to the clinic, run some checkup and all that. Very important. Thank you so much for listening so far. If you have any questions as regards this, this episode, do well to reach out to us, and we'll provide necessary answers through our one and only Dr. Faith. Do well to follow us on Instagram, TikTok, subscribe to our YouTube channel, very important, and also rate us 5 stars on Spotify. Till we meet again, okay? See you on our next episode. Remember to celebrate women and mothers around you. Any woman in your life, any mother in your life, take out time to celebrate them every day, not just on special occasions. They matter to us. You understand? They matter to us at every time. Thank you for listening. Until next time, take care of yourself and stay empowered. Ciao.